This project is really a very significant one for the University of Akron and for the College of Nursing. As a College of Nursing, since 1982, we've had a center for community health, a nurse-managed center, and we've been delivering care to vulnerable populations since that time. Since the early 1990s, we've had federal funding for several years in the clinic for dental health assessment for low-income children and their families.
We are using nurses, dentists, and the dietitians from our nutrition department here at the university. And we will be instructing moms and their children at 2 WIC sites. Now, WIC is Women and Infants and Children food plan that is national. The 2 sites we chose were one here in Akron and at Merriman, and the other in Portage County, which is one of the poorest counties in the state. We are going to then compare urban and rural moms and their children. And one of the reasons we're looking at that is because the water supply is different. The water supply in the rural areas is not fluoridated, and the water supply, of course, in urban areas is, and that helps protect kids' teeth. What we will do for the children and the moms is instruct them about proper oral hygiene.
The Surgeon General describes oral health care or oral health problems as the silent epidemic in this country. In Ohio, for example, it is the #1 unmet health care need of the population. Only 33% of eligible children receive preventive care, dental health care, who are eligible according to Medicaid because of the lack of providers, and there are not enough providers for them. So our grant is actually designed to increase the number of providers for these kids. Oral health, dental caries, particularly those in children, can lead to significant problems throughout a child's growing up years as well as into their adult years. They actually have more physical health problems. It can lead to social problems, speech problems, difficulty in work settings because they don't feel comfortable presenting themselves. And so nurses have a role very early on in an individual's life where they can make a significant difference. Interventions during those early years with fluoride varnish, which is what one of the things that we're proposing in this research, that you can, or we can, decrease the incidence of caries or cavities up to 44%. That's a significant amount.
The other thing I think we'll probably be teaching the moms, besides proper nutrition and proper oral hygiene, is the issue of getting children into seeing a dentist at an early enough age. And one of the ways in which they hope to expand some capacity is to bring in other professionals to assist them. Nurses are a natural because we are school nurses, but also the dietitians are a natural in that WICs are throughout the country, and most of the WIC sites are manned by dietitians. So in that way, I think we can have 2 platforms, so to speak, coming together to reinforce dental care in a way that has not been done before, with professionals that have not been used sufficiently before, and which will have a major impact, I think, on especially the 0 to 3-year-old children, who are the most vulnerable and the least attended to. Right now, only 3% of those children are seen by a dentist before they're 5, whereas 75% are seen by physicians before they're 5. So I think we can perhaps make a pretty important impact here.